Each time I say your name, this love is deeper than simple words can say. You go before.
Hello everyone! I'm back. My name is Maureen Bautista. And 4 months ago, I've just had my fillers and Botox because I have static lines already. And Doctora has explained there are 2 lines that concerns, not just women of today, but also men. So these are dynamic lines and the static lines. The dynamic were the ones, when you smile and then you have creases and lines, it shows. And then when you don't smile, they're gone. But mine are permanent already. Probably because of aging and lack of collagen in the skin and, gravity. It pulls already. So I've had my Botox and fillers and now still fine. That was 4 months ago. Now I think Doctora will do my under eye to put a little bit of puff. I don't know what she's going to do. Fillers, I think, maybe. And she's observing my under eye. And because I'm almost 50, I'm starting to have these dark lines and hollow. So she's going to do something about it that might be looking natural and probably 10 to 15 years younger. Okay, don't forget to click the subscribe button and the notification bell.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. Today, we'll do a follow-up for Miss Maureen Bautista. Welcome back, Mau.
Hello! It's good to be back.
Yeah. So we did a procedure in the past whereby we had these static lines and we used the dermal filler to correct it. And we can see the outcome right now after 4 months, right?
Almost 4 months.
And we have appreciated the elevation of that dented line. So if you can look at the picture, there's this improvement on the surface. It's even, okay, it's smoother, and it looks aesthetically pleasing, right? There you go. So mission accomplished, Mama Maureen.
Yes, very, very happy and satisfied.
So for today, since we're doing like a periorbital rejuvenation for Mama Maureen, we'll also work on the under eye area. There you go. So it's a common concern of a lot of people, okay? Eye bags or the so-called tear trough. There you go.
Exciting.
And actually, I mentioned a while ago to Mama Maureen, ano ba mga causes nito?
Yeah, I was
What
asking.
caused this under eye problems? Okay, so people will start to see this buggy eye or puffiness under the eye, or others discoloration, no? Dark circles. The other like a dented line or like a tear trough. There's a groove there, or even like wrinkles, lines. Others nga, they'll see some skin growth, parang mga milia and syringoma.
Oh, I think I have
And
a bit.
combination of all of this. Plus, the skin is becoming loose, lax. So, nawawala na yung elasticity, nawawala na yung strength, firmness, tightness. Yeah. When we were young, right?
Yeah.
So, actually, okay, factors that will contribute to this, starting with genetic factors, okay? So, like your, like in the family, you look at also the eye area of the members of the family. So, genetic factors. So, you're already inclined to it. If they have eye bags, you tend to have eye bags too.
Yeah.
Or the others like a sunken under eye or hollow under eye or dark circle. There's a certain race or group of people, they have this kind of appearance in their under eyes.
We do have.
And you've mentioned a while ago, lack of sleep.
Yeah.
Lifestyle. So, factors like inadequate sleep or overwork, fatigue, stress. Yeah, those are
Dami naman.
common factors too, common causes too, okay? And there's also like this predisposition to having eye bags, like for example with the diet, like they've mentioned before, like high salt diet, salty food, okay?
And how
Kinda
about
like
fatty?
Yeah, fatty also with the orbital fats, okay? too much of the fat, too much of the salt. Talaga naman, di ba?
Yeah.
Anything na too much ng taba at ng maalat,
Yeah.
it's also bad to our health.
Negative.
Yeah. We also have other factors we call the structural factors, okay? Like problems already in the inner anatomy or structure of your under eye tissues, like yung mga orbital fats mo, hypertrophy, or they are like more or bigger yung sizes nila. Tapos some of the ligaments also, they tend to go down or weaken. The muscles tend to weaken. Then the skin will lose the collagen, elastin. All of those secondary to aging. Okay. Yan, aging factors. Okay. Over time kasi, the muscles become weaker, the ligaments become weaker, the fats may also like either go down or they sag, okay? And the skin structure, nawawala yung mga collagen, elastin, structural frameworks, yan, all of those factors. So, structural factors, secondary to aging, of course. There's also what we call vascular factors, eh. Some people have predominant vessels, blood vessels under the eye area. Yung mga tinatawag na, yung mga nakikita mo, maraming mga vessels, veins dito. Kitang-kita mo yung mga ugat nila. Okay.
And sometimes here,
yeah, the others you'll see some
on the face.
blood vessels visible on the face, or we call yung mga iba telangiectasia, spider veins. Yeah,
spider
so yung
veins.
vascular na yan, predominance, okay, giving that discoloration din. Parang mga bluish, purplish color of the under eye. Tapos pigmentation, yung people who are prone to pigmentary conditions, may mga pigmentary disorders, so factors like that. And mixed types. Meron yung dahil sa medical, may history of allergic rhinitis, eczema, allergic dermatitis, pati eyes nangangate. Yan, they tend to rub, friction also causing that pigmentation, okay? So, some medical conditions, some intake of some medicines, medical factors contributing to this. Yun. Kaya pag nangingitim ang mata, they ask you, meron ba allergic rhinitis? Yan, possible kasi yun. So, lifestyle, genetics, medical factors, structural, vascular, pigmentation, mixed type. Tsaka yung as we age, our skin becomes thinner in the eye area. Yan, as we age, numinipis yan, okay? So, daming, all of those factors eh. Ang dami-daming contributory factors to this under eye problem. Under eye pa lang yan.
I was supposed to jot them down, but I remembered, naka-video pala.
Yeah.
So, I'll just click the button.
Exactly.
Do
and
it
watch
again
it
and again.
Yeah. So many factors
Play it again.
leading to these under eye conditions. And that's why when we treat these under eye problems, of course, we have to determine what is causing it. And we have to treat the cause. Okay? It's not just like doing something, applying something.
Right,
you don't know what's causing it.
Preventing
Tapos, meron ka pa lang mga history of allergies.
Severity.
Then we gave you like a topical cream under eye, nag-react pala yung allergies mo. So we have to determine the etiology or the cause of this. So as doctors, we still diagnose. Baka meron ka palang medical conditions, di na natin alam, right? So we have to do those medical history, physical evaluation also. That's why when you ask us questions, like how much do you treat an eye bag? First, we have to evaluate you po. It's not just like, oh, we'll just give you a cream or, we'll just do this procedure. It's not like that.
Well, that's why if the patient talk, if they have, like they have high sugar.
Yes. We also have to rule out any medical conditions. If you have like diabetes mellitus or hypertension, you're on a certain medication, because there are also medications that can lead to pigmentary conditions. So we have to do really medical evaluation. So this is going into like a medical clinic. We are still doctors. We still diagnose. Yan. Hindi lang basta-basta.
In short, diet first before you do aesthetic.
Yan. Also, of course, like your food, your diet, your lifestyle, you have to do something about it to prevent these problems. And of course, the aging is really a process that will happen. It's physiological. So what we're doing in our practice is we also reverse the aging process. That's why we'll do a treatment for you that will control those weakening of the structures.
The inevitable.
Ayan na. Okay, so we'd love to share what kind of treatment we'll show you when CSA Medical Aesthetics returns. And we're back. So we're still with Ma'am Maureen. Are you excited, Ma'am Mau?
Of course.
So after discussing all those causes or etiology of the under eye concerns or under eye problems, of course, we also have to, okay, we did already an assessment for Ma'am Mau. Okay, we checked her history, and she has been with us for like a long time already, right? We've done a lot of procedures already. So, of course, you have to check the contraindication. So, so far, we can do this kind of treatment for her, okay? And then when it comes to the anatomy, I'll review a bit of anatomy, okay? So, we are anatomists, okay? So, when we look at the under eye region, so actually, it's in the mid-face part of our, the whole face area in the proportions, okay? Middle third of our face, okay? And then we make a marking the delineation of this part, the so-called lower orbital ring here, okay, the bony orbital ring here. So we subdivide, okay, so the lower eyelid and then the upper cheek junction, okay. So we actually even palpate for that bony orbit here, okay. So it's within this line. And we still mark for the so-called tear trough region where there is like a depression there, okay. It's a noticeable depression na, mama, okay. When did you start noticing that this one is becoming over
Actually,
this part?
I'm not so mindful anymore.
Yeah,
because it's becoming.
it's becoming, yeah. And I think
worse.
I understand. When we work in the mid-face section, we have to also watch out for the so-called infraorbital foramen. So this is like located mid-pupillary line, and then 8 millimeter inferior to that, we have the so-called infraorbital foramen. We avoid this because we have like blood vessels there, the infraorbital artery, infraorbital vein, and the infraorbital nerve. So we have to avoid that also, okay, in terms of the anatomy, okay. And then when we work on this part here, when we want to correct anything that's like sunken there or hollow there, of course, you need to use a substance that will fill in and elevate it. Okay, just like what we did here, there's a dent, we filled in with a hyaluronic filler, okay? And then when you want to work on this under eye, you need to know the layers. So we have the upper layer, okay, so the epidermis, dermis layer, okay, part of the skin, layer 1. Layer 2 is the so-called subcutaneous fat layer. And layer 3, we have the fibromuscular, we have the muscles there. Layer 4 is another, like a deep fat again. And then layer 5, we call the supraperiosteal layer.
Oh,
so usually when we inject fillers, we place in the subcutaneous layer, layer 2, or we inject in the above the bone, the so-called supraperiosteal layer. Those are the 2 layers where we place our filler substances. Okay. So when we work on the under eye, when there's a sunken or hollowness there, we fill it in. But also there's a problem when you smile mouth. There's like a bulge also. So that bulge is from your orbicularis oculi muscle. So the contraction of that muscle creates that, we call it like an eye roll. Okay. We just don't want it exaggerated. We want it like lesser. And then it can create lines and wrinkles too. That's why when we work on the tear trough, we fill in with the filler. When we work with the orbicularis oculi muscle, we also inject it with some botulinum toxin to relax it so that it doesn't cause that too much bulge. Okay? And another thing, when we check also the under eye, we do snap test. And then when you release it, okay, I already noticed that the pinch, it slows down. I mean, the return to normal position is slow. Ideally, when you're young, you pinch the skin and quickly it returns to that flat position. But when you pinch it and it stays pinched, ayun na, aging.
Yeah.
Which we don't like, okay?
Yeah.
So when we want to restore also that strength of the skin, the collagen, the elastin, we want to like restore those structural frameworks, structural support. We use like threads, PDO threads, okay? We've done in the past, PDO threads under the eye, the derma spring threads, okay? Right now, we have a product we call PDO powder filler.
Wow.
The very first, the world's first PDO powder filler.
Wow,
Okay,
exciting.
We demonstrated in the past a PLLA powder filler or biostimulator. So we have now PDO powder. So the PDO, instead of being in a thread, in a strand, it's now made into microspheres. Like around 40 to 60 micrometer. Micrometers na sila. Microspheres already. Hindi na sila strand na mahaba. And this is best for people with very thin skin under the eye. Because like when we do threads under the eye, some people have very thin skin. That when we insert that thread, di ba, color blue, we see the bluish
it's
thread.
noticeable.
It's noticeable. So for those people who have very thin skin na, we can use the PDO powder filler. Plus, it will restore the dermis where you have connective tissue matrix. You'll form again the support structures. Because this is a collagen biostimulator in a PDO powder form.
Wow.
So this is the first one. So we're gonna demonstrate it with you guys and we'll show you how we do it. So that's a review of the anatomy plus the product that we will use, which is our UltraCol. Okay. So it's a collagen stimulator. Then we have to also prepare that because it comes in a powder. Then we have to mix some diluent with it, like your sterile water plus your lidocaine.
Wow.
This powder filler also, the PDO one.
And this is the one you're putting the powder.
Yes,
Wow.
the PDO filler is more of the collagen stimulation. I will still need my hyaluronic for hydration. Hyaluronic is powerful in terms of restoring water hydration in the skin tissues. Okay, although the powder PDO filler, they also reported some tissue hydration apart from tightening, firming, and also brightening. They noticed there's brightening. So if you have dark circles, brightening also, or pigments under the eye. Okay? So, as much for the discussion. Ay, dami pa actually. Let's proceed with the treatment. Okay? So, as with any other like filler procedure I do, it's the same technique. Okay? So, we'll be using a cannula method here. Then, I do like in terms of the entry point. Okay? So, my entry point is draw a line from the lateral canthus to your corner of the mouth, and then from the alars to the tragus. So, the meeting point is the entry point. Yun ang entry point. Okay? So, pain freeze, please. So, a while ago, we placed numbing cream. We left it for like an hour. Like, the longer you leave it. So, spray, please. So, this is additional numbing also. We call pain freeze. Okay, there you go. And then, in that section, I'll just make a tiny prick. Okay, inhale, exhale lang, mama. Okay, tiny prick. There you go. And I already have the mixed PDO powder diluted in your what we call sterile water. Okay, so what I do here is I just glide this cannula towards the tear trough section or the medial canthus. Okay, so ideally you want to reach the so-called in this part I prefer the layer 2 because my target is the fibroblast layer, and the fibroblast layer is in our dermis layer. So I'll just gently push the cannula here and then push the product gently. It's like a linear retrograde technique, okay? And make sure that you spread it homogeneously, okay? And then I'll go back again, making it like a semi-fanning method, okay? Okay, Mao? Yeah. So this one, I prefer it in the so-called layer where you have the fibroblast tissues, okay? And we've mentioned that this is made up of PDO, polydioxanone. And polydioxanone is biocompatible. It's an absorbable material, okay, but it stimulates collagen and it restores that good tissue quality. It improves your skin appearance and skin integrity, okay? Just delivering it. Ideally, in one side, you can give as much as 0.5 ml to 1 ml. Okay. Then I can also go to the lateral canthal region to improve the quality of the skin here. So I'll just be very gentle for Mama, okay? So this part here, you can deliver the product and do a semi-fanning method here. So we want to go to the lateral canthal region. And you can deliver again 0.5 to 1 ml depending on the severity of the problem. Okay. Just delivering on this side here, okay? I'm almost. And this product I can use actually not only in the under eye area, in areas where you need restoration of volume, in areas where you need like improvement of the skin quality, even in the forehead region, Mama, pwede rin siya. Yeah, even in the nasolabial area, marionette area, I can also use this. Okay, so we wanted to deliver the product evenly. Okay, so it's just like when we do our dermal filler. Okay, so we've done the right side. Let's proceed to the left area. So we have done the procedure, the so-called UltraCol for the under eye region. We'll show the result to Mama when CSA Medical Aesthetics return. And we're back. I'm so excited to show the result to Ma'am Maureen. Here's the mirror,
Yahoo!
the after treatment.
Wow.
Using the UltraCol, the first PDO powder filler for under eye treatment, those with concerns of eye bags, sunken under eye, or hollow under eye, or even PDO, dark circles or dark under eye concerns. Ayan, parang fresh na lang si Ma'am Maureen, okay? So, we did use this PDO powder filler and injected with our cannula, and we delivered it in that plane of the subcutaneous plane, and we spread it under the eye, and we use the fanning method. So how was it,
Nice.
Maureen?
It's not painful. Yeah, there's penetration I felt, but there's no pain.
Right,
For me, maybe I guess we have different pain tolerance.
Yes, right.
So, but if you're, of course, the result is worth the pain, maybe for
Exactly.
some. But me,
Yeah.
I'm good.
Right. Yet, actually, I had also an experience with PDO threads in the past. But for me, in my experience, it's not really that painful. You just feel something is going inside, or like something like a pressure sensation. But so far, so good. Now, I can see like the skin surface, the skin layer is even, and the lid-cheek junction is improved. Okay, it's smoothened. And then, like the third trough, the one that was dented, it got elevated. Instant result. So you see an immediate result with this one. And the thing with this PDO powder filler, it stimulates collagen. So you have collagenesis within the 1 month period. Okay, so the first 4 weeks, you're developing the so-called collagen type 3. Okay, and then second month to third month, it's becoming your collagen type 1, the mature type of collagen, the stronger type, the dense one. So 1 month, 2 months, 3 months, you're still seeing like the improvement under the eye. So the strengthening of the skin, the restoration of those collagen, elastin, plus also like a development of hyaluronic or production of hyaluronic from your fibroblast cells, because you're stimulating the fibroblast tissue layer. There you go.
Any food restrictions or
Well,
recommendations?
Like every after treatment, I just tell my patients avoid allergogenic type of diet to prevent any swelling. If you have like history of allergies, of course, avoid food allergies, avoid those. Okay, but so far so good. Like me, when I've done this, I ate a lot. Anyway, yeah.
Yes.
And then
that I love.
right. So after this, like you can go back to your work. I could say that this has no downtime. You can do your job. You can do whatever activities you have in the day, because you'll notice there's no bruise. Okay. So like you'll just check on you again for this one after 3 months, because others will need like a booster as early as 3 months to like 6 or 9 months. And then if you do a booster of this kind of treatment once or twice, it could last like 16 to 24 months, like 1.5 to 2 years. There you go. So this is a first powder PDO filler, PDO powder, okay, in microspheres. There you go. So instant result, minimal to no downtime at all. Okay, it's very safe. It has been studied. Well, we've been using PDO for several decades already. So no fear on this one. It's a safe material. It's biocompatible. It's an absorbable type of material. Okay. Any message to our viewers, Ma'am?
It's worth it, and I think for women of the modern generation, the Filipinas today, these are the new norms, the trend. It's a fad already, especially if you're working mom, working woman, or working single woman.
Yeah.
I think to be able to keep up and at the same time updated with aesthetic, you have to at least do something with or a little improvement goes a lot. You don't have to change everything by operation. So I think a non-invasive surgical approach is way, way better. Thank you.
Plus, you look natural, okay?
Yeah.
Not the plastic.
Oh, yeah.
Still
I forgot. Yeah.
There you go. It's
it didn't really change me, and I think my husband still notices that it's still the genuine mouth.
Right. Yeah, since we have done the 4 months already from the time we did the Botox on this part here, we can already add like injection of the Botox on the glabella. Plus also I'll inject a micro dose of Botox on the muscle, the orbicularis oculi muscle, to relax that one and prevent also the wrinkles in the area, to give you a better outcome.
I want to add also, you know, my clients at the salon, no, kasi I do hair,
Yes.
they're asking after the Botox and the filler if I could move my eyebrows, and I'm telling
Yes.
you, yes. Because
Yes.
she doesn't really put a lot,
Yeah, not too
wherein,
much.
you know, you're like a robotic thing
Yeah.
or robotic face,
Not a
no
frozen
expression
face.
at all. Yes, not a frozen face. I tell you, it's also okay. It's just like
Yeah.
nothing. And then they improved on your wrinkles.
Right.
Yeah, they're not really
So we give you a
seen.
relaxing dose whereby you can still have your facial expressions. And of course, you look very natural and
Yeah.
just aesthetically pleasing and balanced outlook or outcome. Okay, there you go. Thank you so much, Ma'am Mau. Like, can they like reach you in your social media accounts?
Oh yeah, you can just
salon also?
Yeah, you can probably go to my Facebook page, Hair at Heart Salon, and you can call. I'm the one doing everything.
Yeah.
Your highlights, your organic hair color, plant-based. You know, for those who are sensitive, those who are pregnant, those who have allergic on their scalp,
Yeah.
those who are cancer patient, and those who are, did I mention pregnant? Yeah.
Yeah.
And also those who are, what do you call this? Asthmatic, because they don't have pungent scent.
Yeah.
Yeah.
Oh, that's cool. Thank you so much, Ma'am Maureen.
And thank you,
yeah.
Dr. CSA. Please
course.
don't forget to click the subscribe button and then
Notification.
ring the bell.
And ring the bell. There you go. Thank you so much. Okay. If you have any questions, you may email us at csaskinclinic@yahoo.com. Our FB page, CSA Medical Aesthetics. Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. So please do watch our other videos and click the subscribe button. And thank you so much for all those who have subscribed already. Okay, so God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.
My light, never failing light, with every breath that I take, I'll declare.